Good morning, good afternoon, and good evening, everyone, and very warm welcome to all of you to today's Micronutrient Forum's Hidden Hunger Coffee and Chai Chat. And in the discussions today, we will hear from Dr. Vilma Tyler on the recently released UNICEF's report, Undernourished and Overlooked, a global nutrition crisis in adolescent girls and women. And we want to hear from Vilma. We want to discuss with you why this issue has been so long overlooked, whereas we know that 50% of the world's population or even more constituents of women and girls. And we know that we all have had mothers, and the nutritional status of these mothers, as our colleague Martin Range used to say, has been so critical during very determining phases of our life. And who we are today really has been determined with what our mothers have been eaten during their pregnancies. So I would like to welcome you here today and also participate actively in the discussions, what we can do to pay more attention to the issue of women nutrition. My name is Saskia Osendarp, and I'm the Executive Director of the Micronutrient Forum. And before introducing our main guest, I would like to tell you a few of the housekeeping rules. And I want to draw your attention to the links in the chats, which includes links to the video that was just being presented and to the UNICEF report Undernourished and Overlooked, as well as to a new white paper produced by the Micronutrient Forum on women's micronutrient nutrition and resilience that has been published in the preparations and in the lead up of our next global conference. So some housekeeping rules is that we will first hear from Dr. Vilma Tyler, who will present the main findings of the report. And we would then like to engage in a discussion with you on this report. And we really want to make this into an informal discussion. Those of you who have been attending our coffee and chai chats before know that these are informal discussions. So while you will be all muted during the presentation, during the Q&A session, you're really welcome to turn on your videos and actively engage into the discussion. It would be good to type your questions in the chat or raise your hand in the Zoom content just to ask your questions. And when you are asked to speak, please make sure to unmute yourself and kindly mute yourself back when you're finished speaking. So with this, I would like to introduce now our speaker of today. And we are very, very honored and pleased that she's here with us today. Vilma Tyler is the Senior Advisor in UNICEF, leading the unit supporting the nutrition of school-aged children, adolescents, and women, including the prevention of overweight and obesity and large-scale food fortification. Vilma has over 25 years of experience in programs, in nutrition programs in a number of regions, such as the Eastern Europe and Central Asia region, Middle East and North Africa region, and in East Africa. We are very pleased that she's here with us today to present the main findings of the recent UNICEF report, Undernourished and Overlooked. Vilma, over to you.
Thank you, Saskia. Dear colleagues and friends from around the world, it is my great pleasure to share with you key highlights from this report, which Saskia has just referred to, which is UNICEF's voice as the global lead on maternal and child nutrition, both in development and humanitarian settings. This report is UNICEF's first comprehensive look at the status, trends, and inequities in the nutritional status of adolescent girls and women globally. Next slide, please. It is also a comprehensive look at the barriers that prevent girls and women from having access to nutritious diets, essential nutrition services, and positive nutrition practices. Next slide, please. Let me start by reflecting on why nutrition matters for the health and well-being of adolescent girls and women, as well as their children. Next slide. As we all know, nutritional status is a powerful barometer of well-being. A well-nourished girl will perform better at school and earn a better income later in life, which will give her greater autonomy to take decisions. If and when she chooses to become a mother, she will enter pregnancy with sufficient nutritional reserves to help meet the demands of pregnancy and is less likely to experience life-threatening complications during pregnancy and childbirth. Her children feel the benefit too, with a much improved chance of survival in their first month of life less risk of malnutrition throughout their lives, and for girls, a chance to break the vicious cycle of malnutrition when they become mothers themselves. Next slide, please. Nutritional status is determined by the adequacy of diets, nutrition services, and nutrition and care services practices. The growing forces of globalization, urbanization, conflict, climate change, and economic crisis are having marked effects on the access of adolescent girls and women to these diets, services, and practices. Across the world, we are witnessing the largest global food and nutrition crisis in modern history. The lingering social economic consequences of the COVID-19 pandemic, combined with the ramifications of the war in Ukraine, are pushing food and fuel prices to record levels. The impacts are falling hardest on the most vulnerable girls and women who struggle most to pull themselves out of food and nutrition crisis. Next slide, please. We are already off course to meet the global nutrition targets of the World Health Assembly and the SDGs that pertain to adolescent girls and women. Current efforts to improve their nutritional status are hampered by a lack of data and evidence on the progress being made and the barriers that persist. To help visibility to adolescent girls and women's nutrition, guide decisions, and build accountability, we set out to answer 3 questions in this report. And these questions are as follows. First one is, what is the current status of undernutrition, micronutrient deficiencies, and anemia in adolescent girls and women? And have there been any improvements since 2000? The second question is, what are the barriers, or what barriers prevent adolescent girls and women from accessing nutritious diets, utilizing essential nutrition services, and benefiting from positive nutrition practices? And the last question was, how can we transform the food, health, and social protection systems to remove barriers and support adolescent girls and women in realizing their right to food and nutrition? Next slide, please. We have a lot of data in the report, which I will really invite you and encourage you to take a look at, but we're going to highlight only a few data points in this report. This figure shows that globally, 8% of adolescent girls and 10% of women suffer from underweight. Further, nearly 1 in 3 adolescent girls and women are living with the debilitating effects of anemia, and more than 2/3 suffer from micronutrient deficiencies. In terms of numbers, this translates as more than 1 billion adolescent girls and women suffering from undernutrition, micronutrient deficiencies, and/or anemia. Next slide, please. While this number of more than 1 billion is staggering, what is even more worrisome is the slow progress on nutrition in adolescent girls and women. As can be seen in the figure, there has been no change in the prevalence of underweight in adolescent girls in any region since 2000. In contrast, the prevalence of underweight in women fell slightly during this period, with most progress being made in South Asia. We also do not see any improvement in the prevalence of anemia, and no region is on track to meet the 2030 global target to reduce the prevalence of anemia by half. Next slide, please. The report also provides concrete evidence indicating that poor nutrition is passed down through generations. The figure on the right shows the timing of growth faltering among children who became stunted before 2 years of age. It clearly demonstrates that about half of the global burden of stunting among children under 2 years of age originates during the 500 days between conception and 6 months of age, when a child is fully dependent on the mother for their nutrition. Next slide, please. Now we would like to look at the barriers. Next slide, please. Women across the world have been hard hit by the impact of the COVID-19 pandemic, and it has impacted their livelihoods, it has impacted domestic care burdens and access to nutrition food. This figure shows that the prevalence of food insecurity was higher in women than men in every region, and that this gender gap considerably widened between 2019 and 2021 as the socioeconomic impacts of the pandemic took hold. In fact, there were 126 more food insecure women than men in 2021 compared to just 49 million in 2019. Since the war in Ukraine has greatly intensified the challenges women face, food and fuel prices have risen to new levels, pushing families deeper into poverty and food insecurity. Adolescent girls and women struggle most to pull themselves out of food and nutrition crises because they lack resources, they lack social capital and bargaining power. And women are often the first to cut back on their food and self-care when their families are struggling. Next slide, please. We find that adolescent girls and women are not consuming the variety of foods they need for adequate nutrition. Fewer than 1 in 3 girls and women have diets meeting the minimum diet diversity. The second figure shows that girls and women in the poorest households are much less likely to have diets meeting the minimum diet diversity than those in the wealthiest households. Many nutritious foods, such as vegetables, fruits, and animal source foods, are simply too expensive to eat daily. As cost of living escalates throughout the world, there is concern that girls and women will cut down on nutritious foods and turn to ultra-processed foods that are a cheap source of energy, but do not meet their nutritional needs. Next slide, please. Discriminatory norms deny the access of girls and women to productive resources such as education, land, income, and social networks, increase their domestic work burden, and constrain employment opportunities, which are all important conditions for social and economic empowerment. As a result, they are less able to take important decisions that affect their nutrition, such as what food to buy and eat, and when to utilize nutrition services. There's clear evidence that women with lower decision-making power have less diverse diets than those with greater agency. Child marriage and adolescent pregnancy are violations of children's rights and have profound negative consequences. Pregnancy can curtail the growth of adolescent girls, and their infants are more likely to be born with a low birth weight and to be wasted and stunted in early childhood. All these entrenched gender inequalities tend to be most pronounced in times of food and nutrition crisis. Next slide, please. As we've heard, the scale of the challenge is enormous, but we can and we must do better if we're serious about achieving gender equality and well-being for girls and women, securing their right to live with dignity and ending child malnutrition. Accordingly, we call upon governments, development and humanitarian partners, civil society organizations, media, research, and academia, and the private sector to take action on 10 recommendations. Next slide, please. Now I will present our recommendations. The first one is build bolder leadership to mobilize institutions, leverage resources, and galvanize actions for improved adolescent girls and women's nutrition more effectively. As such, leaders must promote much greater recognition of the urgent need to nutrition and mobilize institutions, stakeholders, and resources to close gaps in policies, programs, and services. Harnessing data and evidence to inform policy and program decisions and strengthen accountability. Governments and partners must invest in surveys, research, and evaluations to determine how to improve diets, nutrition services, and nutrition and care practices and track progress. As someone had said, what you do not measure does not matter. Accordingly, we're seeing that women are overlooked. Next slide, please. What we must transform We must transform global and local food systems to deliver nutritious diets for adolescent girls and women. We do that by improving access to affordable, nutritious foods, including fruits, vegetables, eggs, fish, meat, and fortified foods. This includes incentives and subsidies to enhance the supply and affordability of nutritious foods, and mandatory food fortification where nutrient deficiencies are common. Implementing policies and mandatory legal measures to protect from nutrient poor and unhealthy ultra-processed foods and beverages. This includes compulsory front-of-pack labeling, marketing restrictions, and taxation of unhealthy ultra-processed foods and beverages. Next slide, please. On nutrition services and protection and social protection programs for adolescent girls and women, we recommend improving access to essential nutrition services before and during pregnancy and while breastfeeding, including in humanitarian crises. Governments and partners must expand coverage, including through community and school-based delivery platforms, and provide free access to multiple micronutrient supplements during pregnancy. Expanding access to social transfer programs, including in fragile settings and humanitarian crises, to improve the access of adolescent girls and women to nutritious and diverse diets. Next slide, please. To improve nutrition and care practices for adolescent girls and women, we recommend using multiple communication channels, print, broadcast, social, and digital media to provide advice on nutrition and care practices, including the vital importance of nutritious diets and micronutrient supplements. Strengthening the coverage and quality of counseling to help adolescent girls, women, and their family members make decisions and take action to improve nutrition. This requires investment in the recruitment, training, and supervision of community-based workers to deliver quality counseling and support. Next slide, please. And the last two recommendations is to improve social and economic empowerment for adolescent girls and women. Accordingly, we recommend implementing gender transformative policies and legal measures that strengthen social and economic empowerment. Governments must ensure that girls and women are legally protected from child marriage, have equal rights to inheritance and asset ownership, and are able to benefit from maternity protection and family-friendly policies. And the last but not least recommendation is to accelerate the elimination of discriminatory gender and social norms to enable girls and women to realize their rights to food and nutrition. Governments and partners must join forces to end child marriage and promote equitable sharing of food, household resources, and domestic and care work. And with that, I say thank you.
Thank you so much, Vilma, for summarizing such a rich and comprehensive report in such a good summary of presentation, and for really highlighting the urgency of tackling the issue and coming up with some very clear recommendations. I would welcome everyone now to join us in the discussion when we start to have a discussion on the findings of this report and also on the recommendations that were put forward on this report, and how we can jointly manage these recommendations together and or discuss the feasibility of some of these recommendations. And I would welcome you to also then open your cameras and start joining the discussion, or write your questions in the chat. I see some questions already coming in. But maybe to start the discussion, Vilma, I think, you know, it's we are very pleased to see this report coming out on Women's Day earlier this month on March 8th from UNICEF. But UNICEF, being an organization that cares about children, to now you know, bring the attention to an issue of women's nutrition really raises the question: why would UNICEF be interested in women's nutrition, and why now? And maybe to start the discussion with these questions, and I think some of that already was in your presentation, but I would like to hear it from someone representing UNICEF.
Yeah, well, thank you, Saskia, for this question. I think over the years, as you said, UNICEF has focused on children, but with that, we focus on everything that impacts a child's health and well-being. And while, you know, in the past we focused on mainly pregnant and lactating women as they impact child growth and, support the child to thrive and survive, basically. Mm-hmm. We realize that women, as human beings, they have a right. It's their own right to nutrition and health. And accordingly, UNICEF realized that, you know, we cannot, for example, address the child and then forget the girls and adolescent girls and women pre-pregnancy. And then when they become pregnant, then we wake up and we decide, oh, we need to take care of a woman's nutrition. So it was important that we use the life cycle approach, and we look at the person from birth throughout their life, you know, to ensure that, you know, when the child after the age 5, you know, we don't stop taking care of them. We continue to support them through schools, you know, to look at how is the school system where children, for the most part, you know, gather, learn, get nurtured. And then adolescent girls who are, as we are seeing more and more, and as I talked in my discussion, I shared in my discussion, vulnerable girls are more likely to get married early. And, you know, if they are not well nourished themselves, you know, it's going to result in them being, you know, less likely to survive the pregnancy, let alone to deliver a healthy child. So accordingly, you know, for us as UNICEF, you know, it's really important to look at the person throughout the life cycle and make sure that their needs, whether nutrition or health or wash or whatever contributes to their well-being, is truly taken care of.
Yes, and as you said, I think, you know, the implications are going further than just the pregnancy period, and really require a life cycle approach here. I also was wondering, and it was very well laid out in your presentation, that obviously the reasons driving these inequalities in nutritional status among women and girls compared to men are often rooted in existing gender inequalities. And if you look at your recommendations, they also seem to kind of cover very hands-on recommendations of interventions that can be immediately scaled up, if you like, such as mandatory food fortification, such as multiple micronutrient supplements during pregnancy, or iron folic acid supplementation in adolescent girls, and can improve micronutrient status. Whereas at the same time, there's also these recommendations that address more these underlying inequities in gender power relations. And I'm wondering, how do you foresee moving forward how we can tackle it? So moving forward on some of those very concrete interventions that we can more or less implement as of from tomorrow, while at the same time not forgetting to address these more challenging issues of gender inequality.
That's a very good question, Saskia. And oftentimes, you know, we as, depending on where we sit, you know, whether as an academician, as a government official, as an NGO implementing, we all have a role to play in this. And first of all, what we're seeing is that women are not seen as equal as men. So that's a first step. You know, we are overlooked. And with that, partly because we don't have data. And as I said, you know, where something is not measured is not being, you know, taken care of, basically. So, you know, we see that, you know, we really struggle to find up-to-date data on the status and the situation of women. And the most of the data that we're finding is from most hard-hit countries in humanitarian setting. And the data is from 12 countries that we have focused on. And mainly we're seeing in South Asia, for example, the sub-Saharan Africa region. And so one of the things we're saying collectively, we need to come and say, okay, each one of us has a role to play to advocate to governments. And whether I'm working in nutrition or I'm working in health or working in WASH, we need to look at what are the things that we need to do to make, first of all, to empower women to make their own decisions, provide them with access to services. Oftentimes women do not have access to services. They're not the ones, the decision makers. If a woman, for example, is sick, she has to rely perhaps on her father or on her partner to take her to the health service. Oftentimes we've seen more and more especially in this food crisis, the men's are the ones who control what food is being brought to the house and how food is being distributed in the house. Also, as we see more women going into poverty, they have less access to education. So the more educated, the more nourished the woman, the more better decisions she can make for herself and for her children. So I think data is a critical point. I think looking at how do we bring services closer to women so they can access them. Because again, women, we see in many, many countries, while we say, oh, women should, we recommend and we advocate, we tell the woman to do it, but there's no enabling environment around her. So, she has to walk long distances to get to for example, to a place where she can buy nutritious foods, or to a place where she can access services. So there's a number of things, very practical things that we can start working on to make life things more accessible to women.
Yeah, well, thank you. I want to put a pin on some of the things that you said to see if we can come back to that later in the discussion, but such as the lack of data, such as the fact that, we need to do this with the man. I mean, engage the man as well. And those of us who have a son, maybe make sure, I know you have a son, I have a son, to raise our sons such that on a personal level. But I want to also give the floor now to people in the audience who have been issuing questions in the chat. And I want to start with Paul Gu. I hope I pronounced your name correctly, Paul. You had can you please unmute yourself and put on your camera? You had a question that related to hemoglobin and to anemia in particular, because I think the findings on micronutrient status in particular are also striking, with over 2/3 of the women being micronutrient deficient and virtually no progress in the prevalence of anemia and in the hemoglobin concentration, as measured by hemoglobin concentrations in women. And your question was related to that, Paul. Can you unmute yourself and put on your camera, or are you not here anymore? Maybe he's no longer in attendance. So we can maybe deal with that question later, because I also see that Fiona Wallace has a question as well. Fiona, do you want to put on your camera and unmute yourself and ask your question?
Yeah, hi. Hi, can you hear me?
Yes.
Yeah, okay, great. Sorry, it's early in Toronto. I was wondering how UNICEF is planning to work with some of the other UN agencies to address some of these issues, because obviously, FAO is trying to fix food systems. WFP has its own, activities to try and increase, nutritional status in various populations. And sometimes from the outside looking in, things can seem very siloed. Is there any way that you guys are working cross-agency to try and, gather maximum impact? And, can you share any of that information?
Yeah, thank you, Fiona. This is a great question, and I think this is something we all struggle with, not only as UN, but other multiple agencies that are working in this space. But I believe 2 years ago at the UN, the Food System Summit, I think many agencies came together, academia, CSOs, etc. And I think we all have our own mandates and our own work that we do. I think this has really brought us together, and we really recognize that we really need to work together. So I'll give you a simple example where we're working very closely with FAO and WFP specifically on this issue. We recognize that school-age children and adolescents, schools, as I said, is a very good place to start working on this age group that oftentimes does not seek healthcare unless they are sick. You know, they don't go for vaccinations. They're not women that are going for whatever, pregnancy-related issues. So we believe that schools are the best place to reach them.
Yeah, great.
So we have, jointly with WFP and FAO, started what we call the School Health and Nutrition Initiative, where we come together with our respective mandates. For example, FAO supports, with UNICEF, we're working closely on how do we develop, and WHO actually, work on a nutrition curricula that is being taught in schools for children about what is nutrition, what is healthy eating, and everything related to physical activity. We work closely with WFP on that, as where WFP in many schools and in many countries, they support school feeding programs. So what UNICEF does is that we support them by making sure that the meals that are being provided that are safe and healthy, and not just like a piece of bread and a glass of milk, but also it's nutritious, and using that as an opportunity to teach kids about, healthy nutrition, etc. And also we work together collectively on how do we improve the school environment and what is being marketed around the schools from all the unhealthy foods, what is being provided in the school canteens. So this initiative is going very strong. We meet very regularly, and there are a number of countries around the world. We estimated last year we have over 70 countries that are starting to implement what we call this healthy school initiative. And it's jointly WFP, FAO, and WHO.
Thanks,
Okay,
that's great.
Yeah, this answers your question.
Thank you.
Are there any other questions from people in the chat, or people that want to raise their hands and want to join into the discussion? If not, I would like to continue with some of the things that we raised, and that brings me back to the lack of data on women's nutrition in general, and I think lack of data also on micronutrient nutrition. So, what specifically is it that you think needs to change in order for us to have data to better track this problem and also to better raise awareness of the issue of undernutrition and micronutrient deficiencies in women?
Is this question to me, Saskia?
Oh, sorry, yes,
yeah. No problem. Yeah, so we believe that this report, just let me take a step back. In 2020, UNICEF issues its first global nutrition strategy, 2020-2030, to align with the SDG. And we have focused on 6 key results area, and we believe women's nutrition was one of the key results areas. And accordingly, every year we try to highlight the issue, one of the issues that is in the strategy, which is in this case, women's nutrition. So this is a first step to show the world, that data is a problem. We have an issue with the women's nutrition, and then calling on governments, partners, donors to look at what each can do to contribute. And as a first step, and Saskia and the Micronutrient Forum, we work very closely, as you know. We have, for example, on the issue of anemia, jointly with WHO, we are co-chairing what we call the Anemia Action Alliance. And we're working on how do we bring collectively, more than just the nutrition community, other stakeholders, partners, to address the anemia issue, because anemia is not only a nutrition issue. So this is one example that we're looking at. Engaging with governments to have concrete actions to address the issue of anemia. As you know, also in the recent few years, we are seeing that the iron folic acid supplements, for example, in women and in adolescent girls, it's not working. Not because it doesn't work, but because, you know, of the many side effects of the IFA. And UNICEF has developed this new formulation. It's made out of 5 micronutrients, vitamins and minerals, that is called the multiple micronutrient supplements, which we are now exploring in a number of countries. And we're seeing a really, really positive results in terms of women really liking them. Women are really accepting them. Women are saying that we feel much better. So in that sense, we are taking different steps to highlight what are the issues that women are facing, and looking at very concretely, working with government on how they can change their policies, how can they also provide financing to address the issues that women are facing. So there are a number of things that we can do collectively. The other thing is related to what I mentioned is there's a huge, if you see marketing around the world of ultra processed foods. As we see more urbanization, more women moving to the cities, more women in the workforce, they are not able to prepare healthy meals for their children and for their families. So what they resort to all these fast foods, the foods that are high in sugar, fats, and sugars that are not healthy, contributing further to the micronutrient deficiencies and the overweight and obesity problem also that we're experiencing. So what we're working also is advocating with governments on policies that restrict marketing of these unhealthy foods, increasing taxation, front of pack labeling, so people are more aware what is healthy, what is not healthy. So we work at multiple levels, first of all, to collect data, but also to highlight what is happening globally and in each region. And we're taking this report, what we're seeing for the recommendations and the findings from this report, and we're doing using every opportunity in conferences, in workshops, both at country level and at regional level, to highlight this issue. So this is going to be a year of advocacy for women's nutrition, and we would like all of you to join us on this as well. I believe women's issue is going to be a key issue this year, 2023, moving into 2024. Hopefully, the Nutrition for Growth Summit, where we all also come together and governments will make commitments to address women's issues.
Yes, thank you. Yeah, and I fully agree with you that these complex issues, such as the lack of data, really require us to work more together and in a collaborative way, and that's very much also in the DNA of the Micronutrients Forum. And I think that tackling this issue from multiple fronts is important too, given the complex nature underlying this issue. There's 2 questions in the chat from people who don't have stable internet and would still like to raise a question. So I'm gonna read them to you. The first one is a question from Paul Gu, which was asked earlier, which is a bit more of a technical question, but it relates to the data that was being presented and whether it is possible that there are women who have a naturally low hemoglobin. And if, I'm also willing to answer that question, but I first would like to hear from you, Vilma, if you feel that may have been something that has affected the results.
Well, I mean, I think when we look at the hemoglobin, as I said, a malnourished mother or a mother who has anemia, is anemic, will most likely have an anemic child. There's an intergenerational cycle of nutrition. It's passed down from mother to child. And that's why we keep saying, it's important that we address it early on. But also, I just wanted to, and Saskia, please come in also on this one. As we know, that low hemoglobin is not only nutrition related. There are many other factors that impact that. So while we know that anemia, perhaps 65% of anemia is nutrition related, but there are other factors such as infections, such as malaria, such as other, that can HIV/AIDS, etc., can result in low hemoglobin. And that's why when I made reference to the Anemia Alliance, we're bringing in other partners from other sectors to address this issue beyond nutrition.
Yeah, very well said. And I don't know the background of your question, Paul. I do think in general, of course, when you look at hemoglobin or any nutrition indicator, there is a natural distribution in the population, with some women having naturally higher and some women having naturally lower hemoglobin levels or lower height or higher height. But what we have agreed with each other is that below a certain cutoff at population level and at an individual level, this is no longer natural. This is really a situation that we consider to be undernourished or abnormal, and that has serious health consequences for the women in this particular case. And that is how we have defined anemia. Now, having said that, as Vilma very well and eloquently said, in particular in anemia, nutrition is only one of the many causes that can cause a low hemoglobin. So it is important that we tackle this simultaneously with other interventions to improve, for instance, the infectious disease rate, while also recognizing that there may also be physical conditions, such as the presence of hemoglobinopathies, that may result in lower hemoglobin levels. And that's why what Vilma said, this Anemia Alliance is so important to bring in different sets of expertise that can help to tackle this issue. So I hope that kind of answered your question. And then another question is from Catherine Curry Quinto from Peru, who has poor internet connection as well. So she's asking how UNICEF is interacting with the governments to try to promote better services to address the nutritional problems in women. And I think that was also one of your recommendations, right, to give women better access and to have better performing services. And how are you working with governments in countries to help to achieve that?
Thank you. This has been a real challenge, because as you may or may not know, in many countries, nutrition services are not available or present in many countries. Especially, I mean, if you're thinking about a pregnant woman that's coming for antenatal care, nutrition, for example, counseling or provision of multiple micronutrient supplements or IFA is not integrated in the antenatal care service. So one of the things that we're doing at a minimum, for example, we're advocating for governments to adopt the WHO ANC guidelines, the most updated one, while the old ones recommend 4 antenatal visits, the new ones recommend 8, but we still see very few countries, very few countries where women are accessing 4 antenatal care clinics. So what we're doing in terms of so first of all, ensuring that nutrition services are integrated within the health services. That's number one. Number two, what we're seeing is that where access, because of lack of transportation, or because of the roads are really bad, or because women cannot afford to access these services, what UNICEF has done in a number of countries, and I'll give you, for example, Bangladesh is one of the countries that we are is a good example, where women oftentimes are working and they do not have time to go to care for themselves, specifically pregnant women. So what we've done, we've advocated to the governments to bring the services closer to where the women are. So in clothing factories, for example, where women are working, they have established health clinics, primary health clinics close to there, and women during their lunch break or their break, they can go for the service, and these services are provided free of charge. The other one is in communities, remote communities, where we've seen women have zero access to communities. We have brought trained community health workers, equipped them with the needed commodities and supplies, and we train them on how to, for example, do screening for women for malnutrition, providing them with the right care, and also in cases where women need extra care, they can refer them to the right services. And the other one is also where I talked about how do we work through the social protection system, because I think this is an important system to support women, especially poor women, vulnerable women, where they do not have the cash to access these services. So through the social policy, through the social protection services, these services are provided free of charge, along with whatever treatment they need, such as like the multiple micronutrient supplements, or if they require counseling, etc.
Yeah, thank you. I think it's very important, right, to have these success stories from countries where we have been really seeing changes in gender transformative changes that helped to make the access, at least, to these services better, or the access to these interventions better. And hopefully also, and I'm not sure, there was one follow-up question that I would have for you. Hopefully also we see subsequent changes there in these disparities in nutritional status in these countries as well. But it may be too early days still to see that, but that would be really something interesting to follow up and also to disseminate more, so that other settings in other countries can learn from that. Do you have more information on whether or not that really led also to improved nutritional status in these settings?
Yeah, for sure. Yes, it is. We're seeing it. And, this is one of the things that we are hoping, is that to document these success stories, because, oftentimes, there's a lot of good work is happening, but it's not being shared. And this is part of our knowledge management strategy, is to document these successful case studies and share them. I'll give you an example on, for example, in Indonesia, women were not able to, we're seeing a decline in the women who are exclusive breastfeeding their children, partly because, they say we need to work, we're not able to take to breastfeed our kids. So what they have done is that, first of all, the government has increased the maternity leave for women, so allowing women to stay at home longer. It's a paid maternity leave, so they can stay at home longer and breastfeed their kids. But additionally, they've set up what they call private breastfeeding rooms in the different workplace, so women can express their milk while they're working, and then they can keep it at home for the kids to feed from the breast milk. So there are little, small, but I think huge advances in this area. Not at scale, unfortunately, but we do have a lot of good examples that we could share.
Yeah, great. And there is a follow-up question on this from Annabelle Makiel. Annabelle, do you want to turn on your camera and your mic to ask the question directly to Vilma?
Hi, Saskia. Yes, I think it was partially answered just now. I was just commenting on how important it is to provide full nutrition services within the full systems of social policy, health and nutrition. But I wanted to know, what you were preparing for this report, because there were certain spotlights for different countries, if there was a specific one in which empowering women enhanced the micronutrient status of women and girls.
So I just wanted something to highlight. As you know, oftentimes when we initiate a program, it takes a couple of years at least to see the impact on the nutritional status. But what we because and the other thing, again, related to data, every time you have to do a micronutrient survey or a nutrition survey, it's super costly, and governments are very, very reluctant. But oftentimes we use testimonies of women. They will tell you themselves. I would just give you, I was recently in Tanzania and Madagascar. We went to very remote villages where the multiple micronutrient supplement were introduced instead of the IFA, and where counseling was provided, where women were felt like they were learn better what it means to eat well, to eat better. So two things they said. First of all, they said, now I know, even though I cannot afford the fruits and vegetables, I was taught that, you know, in my little space, inside the home, I can grow vegetables. I can eat better. And the other thing they said, you know, while pregnant, like especially those who have, this is on their second pregnancy and they're taking the multiple micronutrient supplements, for example, and they're coming frequently to be cared for, they said we feel more energy. We feel that we're much healthier. We feel like, you know, we could do, you know, we're much better. Others said, you know, we lost our first child. Now that I've taken the MMS, I'm eating better. I've had a healthy child. So now, so while we don't know exactly what you know, the micronutrient status of that specific woman, but we are seeing that women are seeking more care, women are feeling much better, and their testimonies are telling us, you know, we want more of this. We can see the impact of this on our well-being overall.
Yeah, that's a very, very powerful way of moving forward with using these testimonies while waiting on more, you know, measurements or more data, which, as you said, always take more time to collect. I'm not sure if there's more questions from the audience, and I'm looking also at the time. We have 6 minutes left, but I wanted to raise one final point that also is related to data, or the lack of data, Vilma, and that is that we are moving to 2030, which is the year that we said the world has committed to fulfill some of the sustainable development goals. And if you look at the sustainable development goals for nutrition, there's only one actually that's specifically targeting women's nutrition and micronutrient deficiencies for that matter, and that's the prevalence of anemia in women. And we have seen no progress in that indicator. Do you think that the fact that we have such few goals that are targeting women nutrition in itself may have been one of the reasons why this is not getting the attention that it deserves?
I mean, you tell me, Saskia. I think so. I think this is something that we have talked about. I mean, even in our reporting, when we look at the data, because, you know, we are looking about how are we progressing towards the SDGs, we're always limiting ourselves. However, you know, in our internal system, we disaggregate this. We look at what does that mean? In order for women's anemia status to improve, what needs to happen? You know, looking at the services, looking at the diversity of women, looking at, you know, the social policy programs that women have access to. So, you know, we internally, we are disaggregating this data, and we are looking at indicators to measure women's nutrition status, better indicator, because I think, you know, rightly so. I mean, we only have one indicator, which lumps everything else, and, you know, which is not really saying that, you know, the only thing that matters for women is anemia, and the rest of it is not important, because, you know, there we have stunting, we have wasting, we have other issues that women are dealing with, and other micronutrients besides anemia. So I think yes, for sure, you know, but I think this raises the alarm that whether it's one or many, there's still huge gaps, and we really need to start paying more attention to it.
Yes, thank you. I see a final comment in the chat by Zora Lukman. I'm not sure, Zora, do you want to open up your camera and your mic and mention your comment yourself, and maybe also the question behind your comment, or do you want me to do that? Zora? I see that you're still muted and your camera is off. But your comment is that so much has been done in terms of women's health and nutrition during the past 50 years, and all what is being said and discussed here has been done by both the national and international organizations all over the world. And nutrition is a donor-driven activity. To me, your question relates to the ownership of this issue, perhaps, if I understand it correctly. And also, you know, despite the fact that we are discussing this and say that we do this, why are we not seeing the progress? I think that that we should be seeing if this is an issue that we are already investing in for 50 years or more. I'm not sure, I'm just translating your comment now, Zora, and I'm not sure if that's the right translation of your comment. So I would love to hear more from you and to see if you can explain it. But I think just to end with this comment, and Vilma, maybe a few reflections before we close.
I mean, if I heard you, Saskia, I don't think we have been investing enough in women's nutrition, and not at scale. All that has been done is, yes, I agree with you, because governments have not paid attention because there's no data. Therefore, they've never paid attention to it. And when donors give money, give it for 1 or 2 years, and then they switch to another project. So I don't think enough investment has been done in this area targeting this age group, and it's never been done at scale, and it's not been done sustainably. You know, we do it, we stop, we have not really followed through on many outright. I've seen it in many countries where I've worked. They do a national nutrition survey. If they do a micronutrient survey, and on women of reproductive age and children, the focus is always on children. If they want to prioritize, they prioritize the children because of funding. So governments are not investing, and donors are not investing, and therefore we are calling on donors to work with us, to come with us and invest more in women's nutrition.
Yeah, so I guess that is also why it is so necessary to move forward in partnerships, and also include strong country engagement in these type of initiatives, right? Which, as you said, initiatives such as the Anemia Alliance is, for instance, doing. But we would love to continue this discussion with you, and there will be an opportunity in several events this year, but particularly want to highlight the Micronutrient Forum Conference, which will be held in October from the 16th to the 20th of October. A link will be provided in the chat. And the conference will be on nutrition for resilience, really looking into how can we engage more in this era of complex global challenges of climate change and COVID and the food crisis and conflicts. How can we make individuals, and in particularly also women, more resilient to face future crises, and how can we do this through nutrition? And I think this will be, we would like to welcome you all and participate in the discussions. This will be a virtual and hybrid conference with a strong virtual component and an in-person component in The Hague in the Netherlands. And you're welcome to visit the website for more information and to register and to continue this dialogue and these discussions. And with this, I would like to also thank Vilma very much for your participation in this discussion, for your excellent presentation and the excellent answers on the questions. And we hope that this will not be the end of a dialogue, but the beginning, actually, of our dialogue, and while we're moving forward and making sure that women's nutrition is no longer overlooked. So thank you very much for a great discussion, and I look forward to welcome you to the next Coffee and Chai Chat and to the Micronutrient Forum Conference in October. Thank you very much.